Manjeet Singh Saluja, Professional Officer, Environment and Public Health, WHO Country Office for India. Mr. Saluja has been working in the area of environment and development since last 2 decades. He currently works with WHO Country Office in India as a technical officer for environmental health that includes issues of water and sanitation, climate change, air pollution, chemicals and its effects on public health. He has been closely coordinating the efforts of WHO Country Office with the Ministry of Health and Family Welfare and the UN partners to integrate and develop the health sector capacity towards various environmental risks. He has previously worked as a technical advisor for the Indo-German Environment Partnership Program of GIZ. He has also worked with the United Nations Development Program and Planning Department, Government of Uttar Pradesh, and various international and national NGOs in various states of India.
Thank you, Varunji, for this very nice introduction. And I'm here to present today on an approach called as water safety planning. First of all, sabhi ko namaskar, and what I'm planning to present today is on water safety planning. So this is a little bit of larger approach, as you know, how we can, we all know that kind of access to safe drinking water is kind of a fundamental to human health and a basic human right. And a lack of access to kind of safe drinking water sources coupled with inadequate sanitation and hygiene still remains one of the most critical public health challenges globally as well as in our country as well. So today in this lecture, I plan to discuss with you about the water safety planning approach. And this approach, which I'm kind of going to share today, is kind of embraces the holistic concept which has been put forward by the goal 6 of the Sustainable Development Goals, recognizing that the protection of water quality and water related ecosystems contribute a lot to the public health protection. So it's in this particular context which I'm kind of going to present to you this particular approach. So what I'm going to share in today's session, I'll mainly cover on 3 aspects. One is kind of giving you the introduction as to what is WSP, as to why is it needed, what are the benefits of it for various stakeholders. Then in the second part, would like to briefly go through what are the steps for this for carrying out a water safety plan, and what are the key terminologies if you are kind of coming across this particular approach, and so what are the key terminologies to kind of focus on, and then how in the national context we can integrate this approach looking at the present programs of the country and the present flagship program. So that's in a nutshell what we are going to kind of present. But before kind of starting, as Varunji shared, I work for the World Health Organization, and kind of wanted to give you a context as to what does WHO do on WASH in this particular area of WASH. And sorry, the slide has changed. Let me go to the previous. Yeah. So what does WHO do on in this area of WASH? So WHO's work on WASH is mainly in 3 main pillars, and as what you can kind of see, the 3 circles focuses on evidence, norms, and the implementation and monitoring. So when we say evidence, we try to kind of synthesize evidence and produce estimates on the global burden of disease which is related to poor water and sanitation and even hygiene. So WHO does a lot of kind of sharing of the global burden of diseases which kind of come out in a kind of a regular, timely kind of manner. Then we also develop a lot of norms or guidelines on water and sanitation and provide technical support to kind of implement them in various countries. As you know, WHO is a member state organization. So, for example, some of the guidelines which are normally referred, we kind of talk about WHO guidelines for drinking water quality, which I'll be also kind of referring to in my presentation, or even WHO guidelines on sanitation and health. And there are also kind of various other guidelines and kind of technical support related to implementation. And then the third part is kind of in terms of the monitoring aspects. So WHO kind of monitors WASH in countries mainly through a program called as the JMP, the Joint Monitoring Program. on water supply, sanitation, and hygiene services. And then we also kind of have a global level analysis and assessment, which is kind of an acronym is GLASS, on water and sanitation. And we also have some other tools, for example, TrackFin, which is the short form of tracking finance, which gives us the bird's eye view of how much water and sanitation kind of investment is going, investments are going in the water and sanitation field in the country, and what could be the critical gaps. So this gives us a bird's eye view for this. So these are kind of some of in the heart of all this lies kind of the partnerships for us, and all these programs are done in partnership with first of all the member states, as well as other national and international partners, for example GMP. So these are kind of uh, uh, this particular monitoring program is done in partnership with UNICEF, and we kind of similarly do many other things in partnership with other UN agencies or international partners. So that's in brief on in terms of the work of WHO on WASH. And as I kind of said, in terms of the guidelines development, so WHO kind of and especially on the work on water quality. So this is the history of WHO guidelines which have been there for monitoring. There we kind of had some international standards and kind of traditionally WHO guidelines have various microbiological parameters, and one of the major shifts which you can kind of see from the second to the third edition of the guideline was introduction of this concept of water safety plan which came in, which as a risk assessment and management approach from the catchment and to the consumer, completing with the water testing for verification that WSP's kind of work. So that was a shift from the second to third kind of edition. And then there was a fourth edition in 2011, and then there's also an addendum to this fourth edition in kind of presently, which is available. And all these guidelines are available on the WHO website, and you can kind of find them and also kind of go through them. So that's in a nutshell on in terms of the guidelines and the whole introduction of the water safety plan approach, which came into these guidelines during the kind of revision of the third edition. So let me now focus on kind of the topic for the day, which is kind of WSPs, the water safety plan, and really talk about why do we really need water safety, this particular introduction in the third edition when we were talking about. So if I talk about the national context, and in 2016 the Indian Council of Medical Research came out with a report on the state of nation's kind of health of the Indian states. And there in that particular, so this report was I think released in 2017, but the data is up to 2016, which talks about unsafe water and sanitation contributes to 5% of the total disease burden, mainly through diarrheal diseases and other infections. So which is still a large chunk of kind of a burden of disease emanating from unsafe water and sanitation. And the burden due to this risk is also kind of was the highest in several of these EAG states, which is kind of the Empowered Action Group, which the Niti Aayog has kind of given this terminology, and Assam. And also it was higher, if we really look at the gender disaggregation, it was higher in females than in males. And this trend kind of continues despite the major programs in India for several decades on water and sanitation to address kind of these risk factors, which means that the conventional approach of monitoring the end product, which is kind of water, is maybe not sufficient to guarantee the drinking water. And the notification for this kind of comes in too late when the testing has happened and people have already consumed this. The notification comes in pretty late that okay, the water is not fit to drink, and many people have already consumed by that time. And the test results are not timely enough, therefore, to prevent consumption of unsafe water. And also sufficient information is not provided to identify the source of contamination as to when it has occurred, or why it has occurred, and where it has occurred. For example, I kind of give you an example of kind of E. coli, which is a good fecal indicator and appropriate for surveillance, but it is not an indicator for specific pathogens. And absence of E. coli does not kind of mean that the water is completely be safe to drink. So it's kind of not it's not a management tool, and therefore kind of not these delay in results hamper the health. And so the issue is that there is a danger in being in reactive approach. So this right now, what the conventional method which we have followed is kind of more of a reactive approach to water quality kind of testing. I just share kind of a few examples out here. Just a minute, let the slide change. Yeah, sorry. So kind of here sharing with you an example of kind of the Walkerton, which is in Ontario, Canada, and kind of this was the year 2000. There was an E. coli outbreak, which was the result of a contamination of drinking water supply of the Walkerton area in Ontario with the Escherichia coli, with E. coli, and Campylobacter bacteria. And the water supply was contaminated as a result of improper water treatment following a heavy rainfall in late April and early kind of May 2000, and that had drawn bacteria from the manure of the nearby cattle, which was kind of used to fertilize the crops into the shallow aquifer of a nearby well. And the contamination, what it caused was a lot of gastroenteritis cases, and it sickened more than 2,000 people, and almost resulted in kind of 7 deaths as well. So we see kind of a small trigger which led to this particular outbreak, and by the time people consumed it, but the results came pretty kind of too late. Another example, and kind of a historic example which we always quote, example of Milwaukee in Wisconsin in the United States of America, and this happened in 1993. So Milwaukee experienced this. It's the largest documented drinking water outbreak in the US history, and it was caused by the chlorine resistant parasite of cryptosporidum kind of paver, and the outbreak kind of affected over around 4 lakh people, and which was at that time almost a quarter of the Milwaukee's population in 1993. So we can imagine 4 lakh people were affected, and it resulted in over more than 96 million of in combined healthcare costs and productivity losses, which was compiled by the US Center for Disease Control and Prevention. And we are talking about in 1993, 96 million was a huge figure, and largest documented outbreak in the US history. So that's what I think are the issues. And recontamination in kind of happens in the distribution line and even at the household level. So even if the water has been treated, it's kind of has been dispatched very safely with after all the tests. But what about the distribution lines, which are kind of passing through many places, and there are leaks happening, they are kind of so, and even at the household level where people are kind of collecting water, contamination can happen there as well, and again ultimately the health of the people would be affected. So there's kind of the intermittent water supply issues which are kind of not there. So what I want to kind of say is kind of not increasing risks of water quality, microbiological as well as chemicals from agriculture and industrial activities kind of can happen. There's now an increased awareness among consumers, so there's a demand for kind of safe water, and therefore everybody kind of when you don't get it, you install the end use kind of water filtration mechanism. So there's certainly an increased demand, and because of which the companies are able to capture it through these individual household filtration systems. There are kind of have been many typhoid and cholera outbreaks in many countries due to the contamination, or more due to the recontamination of water which have happened. And lastly, and kind of which is the most important out here, in our country, in our own country, we are kind of now embarking, after the successful kind of completion of the Swachh Bharat mission, we are now embarking on this journey of Jal Jeevan mission to kind of provide safe and affordable water to every household by 2024, and therefore we would not like to kind of repeat the similar mistakes that have been happened earlier. And therefore this whole Jal Jeevan mission kind of where this to kind of supply safe water to every rural household by 2024 is important kind of milestone which the country wants to achieve. So that's why the water safety planning kind of becomes very important. So so those were the reasons on the importance of it. And let me now come on to what is WSP. So water safety plan, if I kind of really go by the definition, it's a comprehensive risk assessment and a risk management approach that includes all steps in the water supply from catchment to consumer. So it's not only an kind of the end use where you only have to test water from your tap, but it's a comprehensive risk assessment from the catchment to the consumer. Those are the key words which you'll have to remember all through this presentation, and I'll keep coming back onto these kind of terms, and keep emphasizing as to how this can kind of happen. And just to kind of make you revisit on the WHO guidelines which for drinking water, and where this water safety plan kind of comes in. So the guidelines are kind of normally have been set as a health-based targets, and it considers kind of the overall public health content and contribution of drinking water to the disease burden. And eventually the need was expressed as in terms of water quality, performance, or in terms of the technology targets. And the water safety plan therefore kind of comes in as a risk management plan for implement, and then it talks about implementation of stepwise improvements in terms of continuous monitoring and documentation and supporting programs. And you will really understand as the details will come into the next slides as to when I'm talking about continuous monitoring, stepwise improvements. I think these are the points which I'll emphasize. And then finally independent surveillance in terms of the external audit of WSP, and in terms of the verification monitoring. And again, I'll also touch upon these points of what is verification and what is monitoring in my subsequent slides. But just to kind of share as to where this particular thing gets introduced in terms of when we talk about the health-based targets. So just to give you a bird's eye view of this whole approach, where we kind of do a system mapping in terms of what has been the overall, whether it's a city level or a rural level. And again, we'll further discuss as to the flexibility of this approach, which it can kind of do it at a small institution level. And I think when Varunji started, he talked about a healthcare facility, so or a hospital. So we can kind of deploy this particular approach, whether it's an institution, whether it's a rural area, or whether it's these are kind of large urban centers. That's the flexibility of this approach, which we'll further discuss. But then what the components are, we really need to kind of we do a system mapping of this, what is there. Then at each and every level we do a risk assessment, and then we kind of talk about the control measures, and then we talk about what are the kind of the improvements in that particular system, and then in terms of the monitoring and kind of verification. So that's in a nutshell the overall kind of the approach. And within this particular thing, you will really appreciate as when we kind of really say between catchment to consumer. So where the rain falls, the whole watershed approach, at various points there could be kind of contaminants which can make kind of which can contaminate the water. For example, when the rain falls in the catchment area, there could be kind of activities of agriculture going on in that particular area. And when we are talking about agriculture, there could be use of a lot of pesticides and fertilizers in that agriculture. So that runoff from that particular agricultural field can kind of contaminate water at that particular place, and those chemicals can kind of find a place in the water which is kind of coming downstream. Then is in terms of the treatment systems. Again, in treatment system there could be an accident which can kind of happen. Some thing can malfunction and kind of some system may not work, and then again which may again lead to kind of some kind of a contamination. Then is your distribution lines and kind of temporary storage, whether it's a city level or kind of a rural area, and they're kind of moving towards ultimately the household, and again where kind of we can have unsafe storage and handling at home, and within the distribution system. Let's not forget, many a times because of many kind of illegal connections, pipelines are punctured in between, and their recontamination can kind of take place even if there is no chemicals, no accident happening, but still because of kind of puncturing, there could be recontamination which can kind of happen. And even in the distribution systems, again, because of animals or birds in the tank, there could be a lot of kind of issues which may happen. So we see that this whole development and implementation of WSPs are kind of they happen in a very continuous and kind of incremental manner, with improvements which have been made over time. So it's not that we kind of do it at all in one go. There are kind of improvements which are made over time according to the significance of the risks and the available resources, knowledge, kind of which are required. And some utilities may be kind of also more experienced in identifying and managing the risks than others. So, and again, as I said, it is a lot of flexibility in deploying this particular approach. So, and for example, in urban centers, you may have large companies which are kind of deploying this particular approach, which may have they may have a lot of capacity. So they may kind of do things very quickly, but it may not happen maybe in a remote area. So there are multiple barriers again which kind of should be put in place from the catchment to the point of use, so that if one control measure becomes insufficient, there are other control measures which are in place to minimize the risk to the safety of water supply. So kind of that becomes important to this whole approach. So just to kind of summarize this whole introduction of water safety plan approach, when we are kind of talking about, so this approach is a proactive approach, a preventive approach, rather than from where we started, the conventional approach becoming a reactive approach. So we kind of are shifting from being reactive to being more proactive, so that we are able to kind of take care of the public health. Then risk analysis and quality management, which is applied through the water supply chain from the source to the consumer. It identifies threats and weak links in the system. Then build on kind of existing procedures. There's kind of continuous improvement happening, not all at one go. We don't want like everything kind of has been done at one go, and then after 4 days or 5 days, there's no kind of monitoring happening, or kind of systems again collapse. So there are, it builds on existing procedures, and there's continuous improvement which keeps happening based on the increased kind of the new risks which are being introduced in the system. There's transparency, there's telling what to do and doing what you kind of say. And then strengthen engagement within the water supplier and kind of with other stakeholders. The last point becomes very important, that there is an engagement process. There's this whole strengthening of the engagement process with the water supplier and kind of with other stakeholders. So there's a lot of collaboration in that particular approach, and a lot of partnership in that particular approach with other stakeholders. Just to kind of share what could be in for these water suppliers, and what could be there for the benefits of this for the water supplier. So there's more effective coordination and kind of improved efficiency. It encourages other stakeholders to take an increased responsibility. So there's more of ownership, more of responsibility, and which also comes with the whole issue of accountability as well. Water safety due diligence is kind of in place. Better targeting of investments and enhanced preparation for emergencies. And here we are kind of already into a pandemic where a lot of focus is on kind of hand washing. So with, such kind of emergencies, and especially emergencies which are kind of more towards the waterborne diseases. So but here also the water has to be made available for kind of hand washing. So the whole quantity approach also comes in. Clearer identification of responsibility for those within which are outside the supplier control. A strong basis for gaining and retaining the confidence of consumers, and also the financial benefits in the long term, because again there is a lot of kind of benefits and saving of costs because of the healthcare kind of reduced expenses of the population. In terms of the benefits of the customers, which are the end users. There's an increased customer confidence in water suppliers. There's increased reliability and safety. If I can kind of really say, if this is kind of done in a very methodical manner, maybe the customers can kind of finally have a confidence that they don't need water purifiers at their home. They can kind of open the tap and take a glass of water, which we always kind of associate with the Western countries. But then we can also kind of do it here as well, and kind of so that reliability and safety and increased customer confidence can kind of come in, and ultimately translating to certainly better health outcomes, and kind of reduced burden of diseases, and then kind of saving costs due to availability of safe water at tap, which I kind of also initially mentioned, that you will not need to kind of invest in the water filtration devices, and also the whole maintenance of these kind of water filtration devices. So that's the whole kind of benefits which come into the customers as well as to the stakeholders. And again, where I kind of started in my first slide, where I kind of focused on this whole relationship with sustainable development goals. And so water safety plans kind of certainly they are kind of linked to the whole SDG 6, and kind of human right to water certainly kind of stipulates a water supply must meet the 5 criteria which are there in that particular kind of target. In terms of water quality, must be good quality and safe to use. So WSP certainly manage chemical and kind of microbiological safety of drinking water from catchment to consumer. And it kind of talks about the availability, the accessibility of water as well. And the water services must be made available to all, and accessibility, water services need to be accessible within or immediate point of kind of use. And finally kind of translating to this whole target 6.1 indicator, percentage of population which is using an improved drinking water sources, which is free from fecal and priority chemical contamination, available when needed, and located on premises, can be achieved through this particular approach, which we are kind of not talking about, and will be discussing in next maybe another half an hour as well. And when we kind of talk about, so target 6.1 highlights the need for structured actions to ensure water safety management, and water safety planning can kind of become an answer to this particular approach. So that's the whole introduction and kind of linkages with the overall SDGs, and kind of how it is really useful. So that was a kind of a little bit of detailed introduction of the water safety planning approach. Now the next part which I would kind of like to focus is as to what are the various steps for this particular water safety plans, and what are the various modules when we kind of talk about water safety plans. And I would be kind of going through these 11 modules, not very much in detail, because this is a kind of 5-day course, but I will just try to introduce you to these kind of modules, and it will kind of also help appreciate what we were really talking about in terms of continuous improvements, holistic approach, how this is really made functional through this particular approach. We can kind of go through these particular modules. Before coming on to that, let me just take a sip of water, and then kind of let me just take you through these 11 set of modules. Right. So in terms of when we talk about these 11 modules, I would like to kind of focus out here that in India, the water supplies kind of really vary significantly in terms of the size of systems and the number of customers. We may kind of have some water supply system which may be from a few thousand to kind of even several million, where we have these mega cities which the companies are kind of supplying to several million of people. Even in terms of sophistication, some have no or kind of very basic water treatment kind of facilities, poor finances, they are kind of not even adequately financed, while others have well operated and monitored water treatment plants and access to kind of good finances. intermittency of supply. There's, depending upon the place and the geography, some have intermittent supplies as the norm, and others kind of more typically are now even moving towards 24 by 7 systems. We There are quite a few cities now in India which are kind of moving towards 24 by 7. And the degree of management competence, some urban systems may be kind of more akin to a large community system, while others are more kind of like water utility companies in kind of industrialized countries. And then also on the staff training and kind of competencies as well, where some staff may have been exposed to the new operating and management processes, like for example this one, or technologies, while for others this will be kind of could be the first training in the area of work on water safety planning. So with this kind of variety, you need you cannot have a kind of a one size fits all approach. So how this kind of water safety planning becomes so flexible, and that's the beauty of this kind of approach, is when we go through these modules, you can kind of just think in your mind, take a system, whether it's a hospital or whether it's a rural supply or whether it's a large urban kind of system. Take that particular system and start thinking about the various modules, and by the end, when we kind of move, you will have a kind of a system in place, and you can also see that you were able to apply this particular approach in that particular system. And to kind of very briefly present talk about here, so this approach and is adapted and streamlined even for small water supplies. So for example, where I'm presenting about this 11 WSP modules, but when you kind of will go and kind of search the literature, for the rural supplies, there could be only 6 kind of step method which can take place. So ultimately, again, going back to the previous slides which I talked about, the stages are the same. There is a preparation, there is a system assessment, there is a kind of a monitoring, management, and then kind of finally implementation and verification. So those are the kind of stages. We may just kind of see how detailed we may go for when it's a kind of urban system, or how we can go for a rural system or even for an institutional system. So coming to, I think so there's a flexibility in that particular approach. So coming to the first kind of I think this particular module, which kind of talks about assembling the team. So the module 1, which kind of talks about the whole assembling the whole WSP kind of team, and where when kind of while we are going through these steps of WSP, I'll also you can keep an eye on the whole importance of community participation as well at each and every step for the sustenance of this particular whole approach. And when we talk about assembling the team, the whole objective of this particular module is to kind of secure technical expertise with to kind of develop the water safety plan, and the output which would be there is sorry go through sorry yeah and the output which we'll go through is an experienced kind of multidisciplinary team which with sufficient knowledge and background to identify risks and operate the WSP. So what the whole I think the key principle out here is that the team that needs to be there should include the whole management and the technical staff. And again, focusing on the principle of WSPs, WSPs require an understanding which is much beyond only the technical aspects. Whenever we talk about assembling a team for water quality, we normally talk about, okay, let's get a few engineers who kind of really fix this whole supply and kind of really develop this. But water supply is beyond the technical aspects as well. There's technical aspects need to be there, but then there has to be other kind of team members. There has to be a multidisciplinary team which has to be there, and therefore that whole kind of approach of managerial approach, training approach, the whole incident response approach, those factors also kind of need to be focused into it, and therefore it has to be a multi-agency team as well, where not only teams from the water supply kind of division, but also health division, the environment division can kind of need to make part in terms of when we talk about assembling the team. Then focusing on the next kind of the whole system approach, where we kind of know the three modules of describing the system, hazard ID and hazard identification, and kind of control measures, and second risk assessment. So we kind of try to do a detailed risk assessment of the system which is there, and the objectives are to kind of provide a detailed system description with sufficient information to highlight where the system is vulnerable. So what are the weak links in that system? Where is that vulnerability? I think that's where the module 2 focuses on, in terms of describing those kind of vulnerability, and then describing what are the hazards or what are the hazardous events. And when kind of I can kind of also clarify, when we talk about hazards, hazard is kind of which is any agent which could be physical, chemical, or biological or radiological, that can cause harm to public health. So it can kind of help identify hazards or hazardous event, any kind of process that introduces the hazards or kind of fails to remove them from the water supply becomes an hazardous event. And I'll kind of share this with examples in my subsequent slides. Identify existing control measures and what is the effectiveness of those kind of control measures, and then at the end assess and prioritize the risks in the third and the fourth module. And the key outputs would be a detailed kind of up-to-date description of the water supply system which would be there. So just to kind of give you an example of the overall maybe the system kind of the system assessment, and so these are the kind of maps which could be kind of developed, whether it's an urban kind of system or a rural system. But the whole the map needs to describe the whole water supply system from the catchment to the consumer. In other words, and kind of in sufficient detail so as to identify the threats and the hazard of the water supply kind of system quality and reliability. And you can choose the level of complexity appropriate for the local setting. This is a very simple picture which I am kind of showing, which shows the high risk catchment activities and kind of household kind of practices which are prevalent in that area. So similar kind of level of complexities could be increased, the details could be increased, but this is the kind of a bird's eye view of that particular system. Then the whole system assessment kind of maybe I can before even we go to I can share an example out here. Let's kind of know, when we said hazard, hazard could be kind of any agent, when we said which is physical, chemical, biological, or kind of radiological, that can cause harm to the public health. So here is an hazard which kind of a microbial contamination or a kind of fecal material. And a hazardous event could be a microbial contamination of drinking water due to the cattle which is accessing the reservoir compound via an unlocked gate. So there was this is a reservoir compound, and there was a gate which was unlocked, and some of the cattle have moved in, and they could kind of defecate in that particular reservoir. So there would be a lot of fecal material and the microbial contamination that can kind of take place. So this could be an example of a hazard and a hazardous event. So in terms of the objectives, again I think I skipped the slide. The objectives of these system assessment modules is to provide a detailed system description, and as I said, identify the hazard and hazardous event which we have talked about, and again talking about outputs which are detailed up-to-date description of the water supply system which we have already seen, and identification of potential hazards or hazardous events which may affect system and control measures to kind of know to manage these. So that's in terms of the full description. But if we really kind of give you an example of a risk management, a risk assessment table, so you can really see what is the process step, what is the hazardous event. For example, if the process step is kind of now source is a well, the hazardous event could be the bird excreta could kind of enter the well and contaminate the water supply, and the hazard type would be microbial. And what could be the existing control? There are no control measures currently in place to prevent this hazardous kind of effectiveness, and what could be the likelihood we can kind of know. So this is by observation we can kind of give what could be the likelihood, what could be the consequences, what could be the risk factors, and ultimately giving what could be the risk level to this. So there's this kind of beautifully captures kind of the whole system, and what are the kind of risks which are there. Then once we have identified these risks, now we kind of move on to, yeah, the third aspect. Sorry, sorry. Yeah. The third aspect, which is the system upgrades, which kind of talks about the module 5, talks about the improvement plan which needs to be kind of done. And again, the objective here is to document where the system kind of improvements are required, and again to schedule incremental prioritized improvements over time. We target the highest risk, and this risk assessment table gives us which are the highest risk to target. So we target them first to kind of know which are risks, the highest risk to water safety and kind of know reliability. And then the key outputs would be a clear kind of improvement plan which identifies the improvements which are needed and what is their priority, 1, 2, 3, based on the risk assessment, the responsible parties who will be doing what they will be doing, and timings for completion and status. So very clear timings kind of identified out here on completion and kind of status. Again, giving you an example, when we said of the improvement plan, so what needs to be done? We need to exclude the cattle from the reservoir compound. This is a high priority because the risk level was high. How it can be done? We need to kind of erect a new cattle exclusion fence. Who is responsible? The water quality manager of that particular kind of reservoir is responsible. This needs to be completed by, for example, March 2017 or maybe March 22, and kind of presently it is in progress. And what is the associated cost? It could be $5,000 or 50,000 Indian rupees, but that kind of a table can kind of help give you all the details which are there. So that was on in terms of the improvement plans. And then moving on to the next set, which is the operational monitoring and verification, and again which talks about two modules: module 6, which talks about the control measures, and module 7, which talks about the verification aspects. And out here becomes when we kind of really talk about monitoring, and I to kind of also clear your doubts, when we talk about monitoring, monitoring is an act of conducting a planned kind of sequence of observations or measurements of control parameters to assess whether the control point is under control, or whether the water quality meets that particular criteria. So that's in brief in terms of monitoring. But here we are talking about an operational monitoring, and we need to be cognizant of the differences between an operational monitoring and verification. And when we are kind of talking about operational monitoring, this is an act of conducting a planned sequence of observations or kind of measurements of control parameters to assess whether a control measure is operating within the design specifications. So the operational monitoring, we kind of mainly talk about the observations, which is visual inspection, the water sampling and testing. And then comes in the whole verification aspects. And the verification, when we kind of talk about, it's the application of methods, procedures, tests and other kind of evaluations to determine the compliance with the water safety planning. Verification confirms the water quality targets are either being met and maintained, and the system as a whole is kind of operating safely, and water safety plan is kind of functioning in an effective manner. So that kind of brings in that whole holistic approach out here when we talk about the compliance monitoring in terms of meeting the targets, audits, and even the customer surveys, the satisfaction surveys, when we kind of talk about the consumer satisfaction, when we kind of talk about in this particular thing. So that's in brief about the operational monitoring and verification. Then comes kind of the whole the supporting the WSP management, and again there are two kind of module 9 and 10. And here when we kind of talk about the supporting the WSP management, the objectives are to kind of ensure that people and organizations have adequate management procedures for normal and incident conditions, to support the development of people's skills and commitment to the WSP approach. And then the key outputs would be a clear and effective management procedures which are kind of documented, because that learning is becomes very important, supporting the programs to support the delivery of a kind of a successful WSP. And when we kind of again talk about these whole incident conditions, again kind of clearing the term that incident kind of we talk about where a loss of control has kind of led to or kind of being narrowly missed and has led to a public health risk. So so those are the kind of incidents which we need to avoid, and therefore kind of this whole module talks about supporting the whole WSP management on that. And then the last part we kind of talk about the module 10 and 11. We talk about the feedback and review, and where after reviews we take in, and also of the incidents. And again the objective is when we kind of know to incrementally improve the whole WSP based on experiences, scheduled reviews and incidents. So it's not a one-time exercise. We keep going back. We kind of know, okay, this time we have been able to, based on the priority table, we were able to do the first activity. Let's now reassess the system. Let's kind of know now take up this, see where the priority is now. Has the third priority become the first priority, or the second priority has moved on to the first priority? Reassess the system, and kind of know that's where this whole incremental improvement kind of comes in. And then the key outputs is that the WSP is kind of up to date, effective, and continues to be appropriate to the needs of the water supplier and the stakeholders. So just in a nutshell, kind of when we kind of talk about the lessons again, this assembling the team, system description, risk assessment and improvement plan becomes a very often the focus of the WSP efforts. And kind of till the time we have the improvement plan, we are kind of very much focused into the whole exercise. But normally the buck stops there, and that's what is the major risk. And we kind of really need to kind of talk about, if we have to talk about the sustainability of this water safety plan, which is kind of too often neglected. We also need to talk about the operational monitoring, verification, the management procedures, and the supporting programs which are there. And that is why kind of each of these modules becomes important, and not only having an improvement plan and implementing, we should put a full stop, but again this whole kind of sustainability aspect kind of becomes very important. So that was the second part of my session, when we kind of talked about in detail about the 11 modules, and they could be 11, they could be 6, but again going into the 4 steps, the stages of WSP, and how we could kind of really implement those each of these stages through these particular modules. That was the whole objective to take you through. The last part, I think, which I'll take over here, very kind of briefly I will cover, is how WSP kind of this whole approach can be integrated at the national level. And that's what becomes important. And when we kind of talk about this whole integration at the national level, we go through these particular steps, understanding the whole WSP approach, establishing a vision as to know how we can kind of do it. Again, let's not only think of India when we are going through these steps. Attaining practical WSP experience, establishing a national strategy, establishing mechanisms for ongoing support, establish policy and regulatory instruments, implementing the WSPs and verifying their kind of effectiveness, and the review overall kind of WSP experience and sharing the lessons learned. And I think again going back to many of those principles, please keep into mind the flexibility of the approach. Keep into mind that no, not all the steps would be kind of useful, improved. Important that steps have been kind of presented in a simplified stepwise sequence for clarity only. But it all depends upon that particular context, the geographical context. If it's at a national context, again depends upon the country where it is being implemented, that may be pursued in a very, very different order. So these are steps which are not kind of only sequential. They can be taken up as and when required. some steps may be of lesser importance than others, or even kind of fully necessary, unnecessary in some cases as well. We can completely remove depending upon the place where we are implementing, and these steps are here a guide merely and should be again adapted to suit the kind of the national context. So these steps again kind of re-emphasizing the approach that we need to kind of see the system and then accordingly kind of apply these particular steps. But WSP certainly kind of offer an excellent framework for integration of WASH within the existing programs. And when we kind of I talk about integration, mm, it can kind of help in focusing not only on the household water treatment and storage, but also kind of talking about universal sanitation, which our country kind of embarked through the Swachh Bharat mission, and then this whole importance of hygiene promotion, and which kind of has become so very important in this whole COVID pandemic. And again going back to what previously I said, WSPs, when we kind of related to the sustainable development goals, we discussed about 6.1, but it does not stop at 6.1 only. It also talks about 6.2, 6.3, and 6.4. And this particular slide kind of very beautifully captures the whole kind of integration of even the sanitation and the hygiene kind of in this particular approach. Then kind of I think let me come on to the last part and integrate this whole approach to now what we are kind of currently embarking on the journey of Jal Jeevan mission. And there this whole kind of the Jal Jeevan mission, it kind of is focusing on addressing the quantity and quality of water supply. It kind of the vision document of Jal Jeevan mission is talking about the quality as well as and on the quantity. It focuses on multi-sectoral action and stakeholder engagement. It's not only kind of testing at the end, but talking about multi-sectoral action, involvement of other stakeholders, a proactive kind of risk management tool from catchment to consumer. And that's what can be is the kind of opportunity for integration of WSP and JJM. And again the whole flexibility of this approach, because we have JJM would be kind of would be implemented in larger villages or smaller villages, kind of smaller kind of hamlets as well. This whole flexibility can kind of is useful. And this has been pilot tested and replicated in many countries including India. And WS backed by water quality surveillance to ultimately achieve health outcomes. And when I kind of say pilot tested, and I can also share with you very briefly in just 30 seconds on kind of the whole implementation of WSP. Initially, when kind of the National Environmental Engineering Research Institute (NEERI), which is based out of Nagpur, started kind of evaluating this whole water safety planning approach. And they kind of did exploratory study for water safety planning for the city of Nagpur. And I think that particular exploratory study, went on to kind of move towards the whole opportunities which it opened up. And today Nagpur is one of the very few cities in India which is kind of implementing the 24/7 water supply system. So that's where they realized the importance of kind of WSP very early and have moved into that particular approach. And I think NEERI has been kind of been engaged very closely in these discussions, and kind of are going back to the original WSP documents, and there's a continuous kind of improvement which is taking place. So that's in a nutshell the whole three approaches. I think if you want to really focus more on any of these, there is a portal which is called as the WSP portal .org, which has a lot of kind of key WSP resources, the guidance, the country specific guidance, the templates if you want to do the whole issues of climate resilient water safety plants have kind of there. So you can kind of access all of these on this portal, and kind of increase your knowledge on water safety plan, and kind of in your careers when you move ahead. I think you can certainly focus on some of these approaches and implement wherever you are kind of working. So with that, I think I come on to my last slide. I think that was my last slide. And So thank you so much for this opportunity. Thanks to the National Institute of Hydrology for giving us this opportunity. And really thank you, Dr. VC Goel and Dr. Jyoti Patil for inviting us and kind of helping us share this important information. Thank you very much, and over from my side.